body language and how you can look just by doing an in-depth functional medicine physical. You can think of protocols and nutritional pearls that the patient's physiology gives you physical clues. And I was thinking, you know, your body is always talking to you and telling you stuff. I just happened to walk into my kitchen island the other day. I walked into it so hard, I wondered if I broke my femur bone. I couldn't even believe it. It was just unbearable. I was limping around for a day and a half and it never bruised. It never bruised. So that told me that my bioflavonoids and my capillary fragility was really, really healthy. So as you move through your life, your body is always telling you things, and we don't realize how much we can tell by the first few minutes of interacting with a patient. We can do it over telemedicine, most of it, not all of it, and certainly when we see the patient right in front of us. So I thought I would first go through what I do in a really short screen of a physical functional analysis of a patient. And Dr. Wright presented this as a 1.5-hour lecture. So with his permission, I took most of his slides and put them all into this slideshow with my own little fixes on them. So we're not going to go through every single slide, but this is 150 slides that go through the clues of what's going on with the patient and protocols, and even some of them prescriptions of what to order from a compounding pharmacist based on what you see from a patient. And I'm going to go through with you my first shorter version, and then we're going to go through the extended version. And there's a lot of great things in here. So I just love this little thing. We're looking at going for a deep dive, learning stuff from the body. So this was just a cute little video for that. So by observing signs and symptoms, you know a lot of what they say, and we can help the patients more. And then when you tell the patients, well, you know, bumpy skin on the side of your arm is a sign of not handling essential fatty acids and possibly fat-soluble vitamins, then they get really involved with wanting to take their pancreatic enzymes or bile and over a few months get rid of the bumpy skin on their arms. So once you share what some of the signs are, it can get the patient in on it. So one of the first things I do is always I'm looking to see about thyroid, because slow subclinical hypothyroidism is greatly missed. At this conference, and I talked to Dr. Holtorf last night, the new thinking is that on the pituitary, the receptors for thyroid work totally differently than receptors for thyroid peripherally in the body. For example, bisphenol A binds extremely tightly to thyroid receptors on the kidney, on the gut, on bone, but it does not bind at all to the thyroid receptors in the pituitary. So at this conference, they were saying, throw out TSH to give you any understanding of what's going on with the thyroid. Medscape, which is a very conservative online medical journal sponsored mainly by Big Pharma, over the last few years has pumped out a number of articles saying TSH, T3, T4, they're not good assessments of peripheral thyroid action. They even had an article saying if you have a woman who can't get pregnant, she's failed several IVFs, and her TSH and free T3 and free T4 are normal, just go ahead and give her a trial thyroid. You're going to find that some of those women get pregnant because they had hidden cases of hypothyroidism that you couldn't identify. So that says how important it is. Thyroid is a major hormone. You have thyroid receptors on almost every single cell in your body. So what are some of the things that we look at? One of the things is the tongue, because these little scallops on the tongue, and this one is much more scalloped, and this is so this is kind of slightly scalloped over here, if you can look at that. Very slightly scalloped. And when someone has myxedema, which is severe hypothyroidism, their tongue gets huge. So in the process of not having excellent thyroid signals, the tongue starts to hold on to more fluid, and then where it hits the teeth, it leaves a little indentation. So that's one of the things we look at. We look at cold extremities. You really want to feel people's hands and feet. They shouldn't be cold, and ask if they're cold all the time. That's a big indicator. Until I got my thyroid normal, and which is in my like 60s, now I never am cold. Cold isn't my enemy. My hands and feet are warm, but most of my life, cold was my enemy, and they were always cold, and no one talked with me about that. I needed to get more T3 on board for me to feel better. You always talk about transit time because thyroid has a lot to do with moving food through you. So people who have a tendency toward constipation, if they're not going to the bathroom every day, that is a flashing red light of a possibility of underactive thyroid. If they have elevated lipids, because thyroid has a lot to do with the liver being able to process fats, if they have fatigue, and thyroid is one of your major mood modulating hormones. In fact, postpartum depression is usually because T3 has been suppressed by so much estrogen during the pregnancy. In fact, you can pretty much get rid of postpartum depression with a little bit of T3 and a little bit of estrogen, estriol, estradiol. Within a few days, the woman doesn't have any more postpartum depression. Thyroid has a lot to do with the brain. So just kind of trying to get an idea of the thyroid right at the top. Also, if the thyroid, let me go back to this, is a little bit, if you feel that the neck is a little bit enlarged, sometimes you can palpate a little bit. Was a chiropractor, so I have really good palpatory skills. If you feel nodularity on the thyroid, oftentimes benign nodules are a sign of progesterone insufficiency, and progesterone helps thyroid T3 nestle on into its receptor. They're very intermingling with each other. So all these things start, if someone comes in and they have cold extremities and they have a little bit of a thicker neck, and it feels a little lumpy, I start thinking thyroid issues, and you want to take a dive into that. The other thing is the speed of the Achilles reflex. And in my practice in California, which Christine Roche was there, so she remembers the building and the people, we had a machine called the photomotogram, and it measured the speed, the relaxation speed, once you hit the Achilles reflex with a reflex hammer. And a slow relaxation is indicative of slow thyroid functioning. For some reason, that tendon goes, in fact, every tendon in the body relates to different organs, and we could go on just like you look at fingernail diagnosis and tongue diagnosis, but this one is pretty well substantiated. There's a number of articles way back when. This one was from 1990 called Ankle Reflex of the Photomotogram and Thyroid Dysfunction. And in the olden days when doctors didn't have labs, they would hold the foot, put it in the right position, hit the Achilles reflex with the hammer, and see if it felt slow. Now, I've done so many photomotograms, I could just feel if it's slow, which is a very sensitive index of subclinical hypothyroidism. And there's a brand new machine that's doing some of the things the photomotogram did. And they were talking about this machine in Memphis, and it's called the Thyroflex. I haven't ordered it. I've been trying to get a photomotogram in Naples, and we might purchase the Thyroflex, but I don't know enough about it. But the idea that when you let the heel relax, a slower phase is indicative of underactive thyroid function, gives you another input. And then as you get on a program that is efficacious for that patient, the Achilles reflex speed should normalize. So in the olden days, they used this, and what people are beginning to think, because TSH isn't such a great indicator of peripheral thyroid signaling, and we know TSH is what's mainly used, and TSH and T3 and T4 aren't even totally ideal. All of these other signs are important, and cold extremities. You shouldn't have cold extremities no matter what. And so that's the first thing I look at with the thyroid. Then I go down to the feet. And if the feet have calluses and cracks, there's lots of articles from the 40s and 50s that calluses and cracks are due to insufficiency of vitamin A. You have a retinoic acid receptor as a transcriptional factor on all sex steroid receptors. If you don't have enough vitamin A that's bioavailable, none of your hormones work. You can have perfect levels of estrogen, testosterone, saliva, blood, but if you don't have enough vitamin A, it doesn't work. The old-time treatment of menorrhagia for women that had heavy flows was giving them 100 to 200,000 units of vitamin A for a few months to get their body utilizing estrogen better. And in 90% of 44 women in that study, their flow normalized, because vitamin A is very important for hormone signaling. It's also very important that in the crypts of the gut wall, to make new gut wall cells, new enterocytes every 3 to 5 days, you need a lot of vitamin A and zinc. So vitamin A maintains the health of the gut wall, and it allows your hormones to signal. And one of the flashing red lights are these cracks. So I have a lot of problems with cracks on the bottom of my heels, and I was taking 15, 20,000 units of vitamin A, and it wasn't going away. So I just went ahead for 5 days and did 125,000 units of vitamin A and took a little extra pancreatic enzyme. And within 2, 3 days, all the cracks were gone. So if you get to the right dosage, these will go away, but then you don't stay at that dosage. You're usually at a high dosage for a month and a half, and then you back down to a typical dose, but on each person it's different. And remember, I'm in my 7th decade. As people get older, they absorb nutrients less well, so sometimes they need more, or they need a digestive enzyme with it. But vitamin A is important. The other thing is callus formation. You could see it on the side of the toes. You can see it in the ball of the foot. You can even see it on the small toes. I have all of that. I have a hard time absorbing my vitamin A, so I have to be on top of it. And boy, when I take enough of it, I really feel a big difference, because remember, it revs up all your sex steroid hormone signals, and it helps your gut keep constantly regenerating a new gut wall. So this is a good little sign. I also do, in my own little quick assessment, I look at moons of the fingers, because I studied a lot with Chinese doctors early on in my career, and moons tell you a little bit about someone's constitutional strength and energy. So if you have really large moons, that's somebody who, it's suggestive that they have a lot of constitutional energy. And when I run Meridian 24-hour hormone analysis, they measure growth hormone. They're one of the few labs that measures growth hormone, and their growth hormone is very indicative of the more it's in the ideal middle range of good constitutional energy. So when you're working with a patient and they have very poor moons, I guess this one didn't come out, this was a poor moon, you could say to them, this is just a suggestion, but it looks like your foundational oomph isn't quite where it could be. So we're going to take longer to get the results with you that we want to get. If someone's got big moons, they've got really good growth hormone on their 24-hour hormone test, I say you are basically a very healthy person having a problem. But when we find the right answer, it should click in place really quick. So these are little clues, but they tell you a lot. I have humongous moons. My moons take up almost half of my fingernail, and that's part of the reason I have all this darn energy that everyone always wants me to package up and sell to people. Although you have to fight for this energy, definitely, on body, mind, and spirit. But moons give you, it's nice to be able to just see that from a little physical. Then you can also look at the fingernails. If they have white spots, that suggests that they don't have mineral absorption. Main one is zinc, but it means all minerals. And remember, none of the sex steroid hormones can signal unless there's 2 atoms of zinc, a zinc finger at the binding domain that pull the hormone in. So if someone's got white spots all over their fingernails, you know that their hormones aren't working. Right? So this gives you a bit of information. And then if you look at the fingernails, everyone starts getting vertical ridges. They just come with aging. If they're really severe, that might be a little bit of iron insufficiency. But these horizontal ridges tell you there have been a serious infection or a serious malabsorption, and usually protein. You want to take a look then at the protein in the blood. We always like to see the protein in blood be in the 7s. When people have protein levels in the 6s, you know that they're not absorbing for some reason, and that often goes with horizontal lines in the nails. And you can say to people, did you have an infection back then? How has your health been? I don't think you're absorbing your protein as well as you could, and as we get you going better, your nails should come out now much stronger with less of these lines. If we're getting you all your results that you want, your nails should do this and that. So it's amazing what just taking a look at a patient can do. And a few other little things in the skin This is rosacea. Of course, this is a severe case of rosacea. This is a mild case. Some people come in and it's just two little reddish blotches there, but rosacea is very suggestive of insufficient stomach acid or an H. pylori infection, because that's one of the most common causes, especially in younger people, of not having enough stomach acid. That bug, that bacteria, H. pylori, blocks parietal cell secretion of stomach acid. So looking at the cheeks is always a really good thing. So this is this is research proven in the 1920s to be cause rosacea by bacteria growing in the stomach. Hypochlorhydria is very common. This is from Dr. Wright's slide. So he uses HCl with pepsin. I never use pepsin anymore because the one study that tested whether pepsin made stomach acid work better or not couldn't prove it. And it can aerosolize and northerly up into the esophagus if there's reflux and damage the fragile cells of the esophageal epithelium. So the new ENT docs that are really into reflux, they recommend not avoiding pepsin. So this was from his slide. Interestingly enough, Dr. Wright treats rosacea by making sure there's no Helicobacter pylori, ruling it out and treating it, giving vitamin B12 and folate by IM injection. So he says that's the way to do it for people with rosacea, and giving stomach acid. And you would do a stomach acid challenge test to just determine how much that individual would need. Vitiligo is another presentation that suggests stomach acid insufficiency and often rule out hidden gluten sensitivities. And these are some of the other nutrients that help vitiligo, which is not that easy. It takes about a year to get rid of vitiligo, but if you rule out H. pylori infection, you give stomach acid and digestive support, you identify reactive foods, and you give some of these nutrients, you could say to your patients, this should be greatly improved within a year. Skin conditions take the longest to improve of most conditions. I don't know why, but skin conditions that are chronic take anywhere from 6 months to a year to get rid of. And often vitiligo, you get rid of much of it, but not all of it. The arms, this is what I was talking about just a little bit earlier. On the side of the arms, I tell patients to feel the skin on the side of your arms. And if there's keratosis pyloris, which means bumps on the side of the arms, it suggests not absorbing essential fatty acids, which could also include your vitamin A, vitamin K, vitamin D. Maybe there's bile insufficiency. Maybe they have gallstones, food reactivity, or low digestive enzymes. But your arms, I remember I was at a conference with Pam Smith. There were 500 physicians and pharmacists in the audience. She had everybody stand up, take off their jackets, touch their arms. And she said it was because of reading my book, Healthy Digestion. And she said, if you got bumpy skin on the side of your arms, you're not absorbing your fat-soluble vitamins. So you can just tell patients, look at this. You're taking vitamin A, vitamin D. You're not getting the best of it. Let's get rid of those bumpy skin on the side of your arms. So as crazy as that sounds, and skin tag. Skin tags are, I don't know how to get rid of these little pictures here. I'll have to work with Karen and Sarah on that another time. So skin tags often show up as little pedunculated pieces of skin under the neck or under the axilla. And the biggest thing that they are a flashing red light to suggest to you is insulin resistance. And the more people have skin tags, the more their risk of getting type 2 diabetes. And this research comes from Walter Reed Hospital, where they looked at thousands and thousands of veterans with skin tags and were able to identify this association. So even though they're caused by a virus in a large majority of patients with skin tags, they're indicative of insulin resistance and potentially type 2 diabetes. They found at Walter Reed that 80% of people who had 3, 4, 5 skin tags, and as you improve insulin sensitivity, these skin tag formation starts to go away, because you can remove them, but they'll come back as the insulin resistance still stays there. And as you improve insulin resistance, which of course is so many things that you can do, and never forget you want a great formula that has vanadium in it, because vanadium really helps reboot the PPAR gamma insulin receptor. And all the different things that you can do to improve insulin resistance, but whatever supplement you use, there should be some vanadium involved. And then if you look at people's creases, so there's neck creases, there's groin creases, there's armpit creases. The neck creases could be in the front of the neck, they can be in the back of the neck. This is called acanthosis nigricans. And it's also a sign of insulin resistance, and it often shows up in a patient with lots of skin tags. So someone comes in and has all this discoloring and skin tags, you already have a high understanding that you got to work on, they have a metabolic syndrome or a metabolic syndrome about to happen. And that's one of the things you need to do. And the art of looking at a patient like this is so lost when it's so wonderful of how much it can tell you. Now, sometimes people with hypoadrenal function will have hyperpigmentation around areas like the side of the mouth. Um, they might have it down an area of the crevice of the arm. So some hyperpigmentation can be due to people who tend to be hypoadrenal. I only have one adrenal gland, and after I had that one adrenal gland moved when my kidney was removed, I started developing areas where I had hyperpigmentation until I got my adrenal function back on track. But I still I got rid of much of it, but not all of it. It's kind of hard if you have hyperpigmentation to get rid of all of it. But hyperpigmentation is shouting something out to you. The acanthosis nigricans tends to be blacker than the adrenal insufficiency hyperpigmentation, but both of them need to just be noticed. And then of course you can always just look at the top of the head. This is the real quick assessment that I do when I have a patient, and then we're going to go into more detail. If there's a lot of dandruff, then you know they're not absorbing their essential fatty acids. And Dr. Wright would make a compounded cream that he would have them rub into their hair, and he would have them the compounder use lithium in that cream. So the cream was made of vitamin B6, lithium, and he also recommended essential fatty acids, and he said that got rid of seborrheic dermatitis in 95% of the cases. Easy bruising. Many women as they get older bruise a lot, but when you get on the right balance of supplements and hormones, you shouldn't bruise at all. I just walked into that island so hard in my kitchen. I thought I was going to crack my femur in half, and I can't believe I've had no bruising at all. That's the sign that you're on the right amount of C. I always love to give a C that's half vitamin C and half rutin and bioflavonoids. And my favorite product for that is Zymogen Vitamin C 1-to-1. That's the name of the product, 1-to-1. There's not a lot of products that have this bioflavonoid and rutin, and you want tone to your capillaries. You don't want that you're bruising very, very easily. And usually it means that you're a little bit low in vitamin K or flavonoids or both, and you make more vitamin K by taking probiotics, or you can supplement with vitamin K, but you can just go to that vitamin C by Zymogen, the 1-to-1, and take that as your C source. That's what I've been doing in COVID, and my capillaries have gotten so strong. And staying at home and eating, you saw all the colorful foods I posted. All those colors have, it's been a boot camp of getting myself into shape. A study came out today that people that eat out more frequently die more often prematurely from all-cause mortality, because you tend not to eat as healthy foods and you get exposed to unhealthier fats. So COVID has rebooted the nuclear family and eating home a little bit, and also the integrity of our capillaries. The nose can tell you things, and what's very interesting about the nose is these little dilated lateral veins are also a sign of hypochlorhydria. And they start off and coming up in the later 6th to the 7th decade, and their suggestion of not enough stomach acid. Whenever you have a suggestion of not enough stomach acid, you also have to rule out H. pylori. And the way to get rid of these, because no one likes them, I started getting them myself a little bit ago, and the only way to get rid of them is photofacial at a dermatologist. And you go through a photofacial session, and everything darkens for about 5 or 6 days, and it sloughs off and they're gone. Also, Retin-A is very helpful. I believe that everyone should be on a retinoic acid, as we talked about in the beauty bundle talk, because it really reduces cancer cell formation on your face, and it's so awful to have to go through Mohs cancer procedures on your face, but it's also a little bit helpful for these dilated veins. It can be a sign of alcoholism, but it happened to me and I'm not an alcoholic for sure. So it can also be a sign of insufficient stomach acid. You always want to rule out that bacterial infection, H. pylori. And then with the nose, there's always the allergic salute, because if you have an allergy, you tend to have a little bit of nasal drip, and then you push up your nose to kind of get it all up there. And if it's done over and over and over, it tends to make a little crease. So in an African American person, the crease would look dark, and usually in a white person, the crease looks a little bit light and whitish or reddish. So I was on Good Morning San Francisco when I was working in California with Doris Rapp. And we were on the show, and she went into depth about all the signs and symptoms that you can look at somebody's face. If they have the allergic salute, you know they have allergies they haven't identified. If they have Danier's lines, which are dark blotches or looks like you have extra lines under your lower eyelid, they're called Danier's lines, or the raccoon look, the darkened area under the eyelids, that's all a sign of allergies that have not been identified. And also, she said, if people get red ears right after they eat, so you can ask your patients, have you ever noticed this? Some people get bright red ears right after they consume a meal, and that is another sign of allergies. So these are just the quick little things you can tell a lot about a patient. And then I also always in my physical try to get an understanding of muscular integrity in your patients. So I'll have women make a bicep and touch it, and then make to contract their quad and even to contract their abdomen and have them push against it, because most people have very poor muscle recruitment and integrity. And muscle is what you want to slow down aging and have a healthier older age. Muscle helps preserve so much of your life force. So you have to fight to maintain your muscle. This is a woman who's 81 years old. She's an iconic bodybuilder exercise person. I've heard her interviewed on Oprah. She lives a pretty pristine life. It's kind of crazy. She's married to her mate, her best friend, and he looks like he's 95 years old, and she looks like she's fantastic. In her exercise classes, they're just filled wall to wall with people who are inspired that this woman took up bodybuilding at 55 years old after her sister died and is so healthy. So you have to understand that your heart is a muscle. Your gut is surrounded by muscle. So I say to my patients, you want me to help you be better. You want me to balance your hormones. You want me to help your digestion. You have to understand that a lot of what's inside of you is muscular. So if you get very, very lax, because a lot of people come in, they're 38, 42 years old, and they're just, there's nothing there. You have to say to them, well, inside of you, your muscles are not toned enough. So and the other thing I always ask is, have you had a history of sinus infections? Do you have a lot of postnasal drip? Do you have any polyps in your nose? Because now we know that the gut starts in your nose and your mouth. So those are all signs of dysbiosis in your nose, and you would measure them through the company that you get nasal swabs, are called microbiologydx.com. You can get nasal swabs, and you can order them for bacterial. You have to order each one separately. You have to rule out bacterial infections, fungal infections, and biofilm. And they tell you if you're Marcon's positive, which is a sign of environmental illness. So looking in the nose now is a big part of the functional intake and keeping someone well. If they have breast cancer, you want to know if they have any biome issues in their nose. If they have fatty liver, you want to know if they have any biome issues in their nose and mouth. Half of colorectal tumors have pathogenic bacteria that come from the mouth. So in an exam, one of the things you ask is, do you have trouble breathing? Do you have chronic postnasal drip? Do you have to wipe your nose a lot that's not due to allergies? And do you have a history of sinus infections, recurrent sinus infections. Doesn't even have to be in the present. That would tell you that one of the tests you want to add into your intake and evaluating this patient is the microbiology DX. They also do where you do dental floss between your teeth and they can measure the bacteria. It's hard because a lot of people have a lot of pathogenic bacteria in their teeth. It's very, very common, and it can make people very upset because so many people come back with almost every bacteria positive. So I've started to focus more on the nasal biome and not do the oral biome, but just talk about oral health. Otherwise, it gets really difficult when someone comes back with, I think, there, you might have noticed this yourself. So with a chronic stuffy nose, you want to rule out food allergies. You want to make sure there's no infection. You want to get some idea of the biome. That's what would be an infection would be dysbiosis. But is it a fungus? Is it a virus? Is it a bacteria? Most often it's a fungal infection. So I had this 82-year-old woman in Tulsa, Oklahoma, who had had cancer twice, but she brought in a plastic bag what she blew out of her nose every morning. She said, "You wouldn't believe what I blow out of my nose every morning." She brought it in a bag. It was just filled with mucousy material. She said, "I've been put on so many antibiotics and antibiotic sprays and nothing has worked." Well, it was a fungal infection. So we did the microbiology DX, and then I just gave the results of that to the compounding pharmacist, and because they give you a sensitivity of all the medications, and requested, and I was working with Dr. Block, so it was under his license, to do a compounded nasal spray for this woman specifically for fungal infections. And within 3 weeks, for the first time in 20 some years, she didn't have to spend 20 minutes in the morning blowing out her nose. But you can also try the xylitol. You can mix a little bit of xylitol in water and spray that up the nose. But chronic mucus in the nose can suggest iodine deficiency, which is also suggested by the size of breasts. Bigger breasts need a lot more iodine. So women with large breasts tend to come in iodine insufficient. Iodine resides in all of the hormonally concentrated organs, the thyroid, the breasts, the ovaries, the prostate. So people with any health problems in those areas, fibrocystic disease, breast cancer, benign prostatic hypertrophy, they often have iodine insufficiencies. People who don't respond to anything else, nebulizing with hydrogen peroxide is something I haven't done, because I can't write the script for that, but a number of my colleagues are saying how well this is helpful, especially for nasal polyps. So I had a chiropractor that came to see me with a lot of serious health problems, and we got him back on track, but I wanted him to get ozone and I wanted him to get hydrogen peroxide nebulized. So he happened to live close to Schallenberger. He went to Schallenberger's office. He has just suffered with severe nasal polyps to the point where when he spoke, you could hardly hear him. It was so nasally, and he had a lot of pain and drainage. So 4 times a day, he nebulizes with hydrogen peroxide. In 2-3 days, he had no more polyp problems. And then within a few weeks, they actually went away. The body just absorbed the polyps. And you would, of course, want to look at all the other biomes, but nebulized hydrogen peroxide appears to be a very positive thing for nasal polyps. Dr. Brownstein uses it for his first line of COVID intervention. He has people for the first 24 hours nebulize with hydrogen peroxide every 4 hours because it tends to be antiviral, fungicidal, and bactericidal at the same, my understanding. I haven't worked with this, but it's something for you to consider. You also want to rule out Helicobacter pylori. Here's a study that involved 30 patients with nasal polyps, and it was detected in all of them, all 30 patients. So anything that grows out of control, you've now looked at vitiligo, rosacea, nasal polyps. There's so many things that are linked to not enough stomach acid. because H. pylori blocks stomach acid production. H. pylori is a very common infection, and once it's treated, you have to retest it the next year and the next year after that because it has a high recurrence index. Most of the time, people go on the triple cocktail and then never are tested again. But H. pylori does damage the parietal cells. If you have an infection for a year or two, often the parietal cells will kick back in, but sometimes they're damaged irreversibly. And some people with a history of H. pylori have to be on stomach acid replacement permanently. H. pylori is linked to an increased incidence of stomach cancer, but most people are not aware that it's linked to an increased incidence of all cancers. So H. pylori in any cancer patient or high-risk cancer patient must be evaluated and ruled out. We just order it in the GI map. You can add the H. pylori as part of the test if you request it. You can also do a breath test for H. pylori, but it is important to eradicate it. There's a lot of misunderstanding about H. pylori because it's so common. People think it's not that big of a deal, and they don't understand its link to cancer. And it's very hard to understand it. And I think what's going on is that your stomach acid production has a lot to do with keeping the rest of your body globally alkaline. And an alkaline environment is less hospitable to inflammation and carcinogenic cascade effects. So H. pylori sounds so mild because it can be in daycare. You can have multiple cases in daycare, and it seems like it's no big deal. These little kids got it. But it tends to create an environment that then puts the rest of your body off kilter, and maybe that's why it's linked to other cancers. Nasal polyps can also be due to environmental allergies, and sublingual desensitization is great. There's a ENT doctor in my area named Dr. Slaughter, and I send lots of patients to him because he desensitizes them with inexpensive drops. It takes a year of sublingual drops and they get over it. So I'm a big fan. I'm now working a lot with desensitization of hormones for people that are reactive or don't handle hormones well. So desensitization under your tongue is a really great way to deal with everything from nasal polyps and environmental allergies to hormones. So the nasal polyp treatment, this is something that Dr. Wright talked about, non-surgical treatments if H. pylori is detected, and he did something I've not heard of. So if H. pylori is part of the polyp, he used a bismuth and or progesterone in a low DMSO nasal spray, and he also used a nickel dibromide that I have never worked with, and also hydrogen peroxide. So these are all possibilities of interventions for H. pylori and for nasal polyps, and of course getting rid of the H. pylori. And then you can also take a look at the face. Now we're going down more through the rest of the body. That's what I look at when a patient comes into me. And the only thing you really can't do through telemedicine is that Achilles heel reflex, because you have to hold the person's foot or have them linked up to that photomotogram or the Thyroflex, which I have never used yet. But everything else, you can have them put their hands up to the Zoom. If you're doing a telemedicine, you can ask all those questions and you just got all that information from just 5 minutes when you first look at a patient. But now we have almost 150 slides, so we have a lot of information we're going through. That was like my little short run through, and we're not going to go through every single slide, but the slides that I think make a big difference. But you're all going to get this entire slideshow to keep as your reference to learn all of this. So you are going to have access. What we're going to do is we're going to make a PDF of this slideshow, and you can have it on your computer. But because so much of it comes from Dr. Wright's slides, you have to promise not to share it with anyone else. You can certainly talk about it. You could have a lecture on it, but you can't give these slides away to anybody else. Is that okay with everybody? If we give you a PDF of this so that you have it at your access? So with acne, you always want to rule out food allergies, especially milk, dairy, wheat, corn, citrus, chocolate, soy, and peanuts. Eliminate sugar and carbs. Add in foods containing zinc and essential fatty acids. Often in the old-time literature, zinc picolinate and pyridoxal 5-phosphate given together were nutritional antibiotics that cleared up skin. So I used to have a treatment with people with acne where I'd give zinc 30 to 50 milligrams twice a day, depending if they had white spots on their fingernails and if I thought their hormones were working okay. Because you can decide if you want anywhere from 15 milligrams twice a day to 50 milligrams twice a day. Based on now some of these other signs that you saw, you get an idea of how much zinc they need, because now you know some of the signs. And I'd add pyridoxal 5-phosphate, and we'll give you some signs of why you would know with that, but often it's 10 to 20 milligrams twice a day, but in a very serious cystic acne, it might be 50 milligrams twice a day for about a month. The other thing I did is I had them take nutritional yeast, cayenne pepper, and a little bit of apple cider vinegar, and wash their face really well, put a hot cloth over their face, and to open up the pores, and then take this mixture of nutritional yeast, cayenne pepper, and about a tablespoon of apple cider vinegar, stir it around, make a mask of it, let it dry, and wash it off, and do that once or twice a day. You'd be surprised at how well this gets rid of cystic acne. It's an old-time treatment that I used a lot in the clinic. Here's some more. He's talking about adult acne, and he's giving you a recipe that Dr. Wright uses, which he says to a compounding pharmacist, this is my script, 4% niacinamide and 10% vitamin C cream. And he also talks about a topical azelaic acid and pantothenic acid or tea tree oil. So he calls up the compounding pharmacist and says, I've got someone with cystic acne, the zinc, the P5P, the nutritional yeast, and the apple cider vinegar and cayenne didn't work. This is the next level up. These are some possible formulations that you could order. We know that acne that's premenstrual is often due to the three musketeers, the three nutrients that play a big role into keeping hormones balanced right before the period, along with sufficient progesterone. You know, most people start getting PMS symptoms because they don't, it's a flashing red light that they don't have progesterone. So a woman, when she's ovulating regularly, has very regular periods, every 28 days, every 30 days. That's a sign of a woman whose progesterone mid-cycle most likely is pretty healthy. The minute the menstrual cycle starts to be different numbers of days, you know that that woman is starting to ovulate sporadically, and she's probably not having enough progesterone. Some women say they had PMS early on in life, then they didn't have it for years, and now they're developing it again. That's progesterone insufficiency. Breakthrough bleeding, mid-cycle, progesterone insufficiency. It's usually the hormone that goes down first. And so you just want to think, and one of the reasons these three musketeers work is they all promote healthy progesterone signaling. So B6, magnesium, and zinc, B6, magnesium, and zinc, they're the three musketeers to help with premenstrual issues and progesterone. So if a woman is, you know, in her 20s, you're probably not going to give progesterone, but more and more women are getting perimenopause at younger and younger age, like little whispers of it. So you never know. But does that help you just think of all those different signs and everything? We're going to run through some of the slides quicker because we're not going to go through 150 slides. But so I think we've done enough on acne, but this gives you lots of different things. It gives you some different creams and so forth. Interestingly enough, he would use high dose vitamin A in boys, but not with girls. Why? Because what did you just learn? That high dose vitamin A really activates estrogen and the use of hormones. So in girls, if you give a young girl too much vitamin A, she becomes a little estrogen dominant. Vitamin A really helps estrogen work. So he uses vitamin A more for teenage acne in boys. So interesting when you start learning the physiology. So this goes into that dose. Here's atopic dermatitis and eczema. You want to check in many of the skin conditions, it's become apparent to you, you want to rule out stomach acid insufficiency, rosacea, vitiligo, atopic dermatitis. Your skin needs powerful stomach acid secretion, and what might block it? One is age, one is antibodies against the parietal cell, and the other one is H. pylori, and it's also stress. So the body prioritizes tissue, in a sense, based on how many mitochondrial organelles per cell volume are in that tissue. Because mitochondria create energy, but they also dictate higher they're the higher executive personnel inside a cell to make sure that everything is working out. We're learning that mitochondria do a lot more than just create energy. They're like big time executives directing action. So if a cell has half of its cell as mitochondria, or 50 to 60%, that means that that cell is very sophisticated and very necessary in the body. The parietal cell that secretes stomach acid has more mitochondria per cell volume of any cell in the entire body. The next is the heart, and then underneath that is the hippocampus. Those are the three greatest demands of mitochondrial energy and executive functioning, but parietal cells are at the top. And you get a window into parietal cell sufficiency somewhat by the skin. Of course, we also know if you have symptoms that occur more right after you start eating, if you have burping, we have all those kind of things. But looking at the skin tells you a lot about stomach acid. And stomach acid isn't something that modern contemporary gastroenterologists are concerned with. They just don't. Sometimes they measure it, but on the whole, it's not part of their milieu to identify and treat these issues. Atopic dermatitis can be helped by Lactobacillus rhamnosus. So some patients, you just put them on Lactobacillus rhamnosus, and in particular, it's the strain called LGG, and it was discovered by Tufts University that this tends to help atopic dermatitis. Isn't that crazy? But nothing helps everybody. So you might have one patient with atopic dermatitis and you give them lactobacillus pills twice a day, 3 times a day for a month, and they clear up. Other patients, you have to check their stomach acid secretion, maybe add some pancreatic enzymes to it. But the skin often tells you with chronic skin issues, rule out food allergies, rule out stomach acid insufficiency, which then means rule out H. pylori, and always take a look at essential fatty acids, because that's what gives the skin a lot of its sebaceous activity, along with DHEA. Dehydroepiandrosterone, DHEA hormone, helps create sebaceous moisture in the skin. So part of getting older and crepier and not shining as much as you're in your 50s and 60s is less DHEA action on your skin. That's why if you take DHEA and your body can't handle it, you can tend to get a little bit of acne, and then you might have to go to 7-keto DHEA. So here's some more studies on atopic dermatitis. A recent report showed that L-histidine, 4 grams daily for adults and 800 milligrams for children, significantly reduced atopic dermatitis. So there's a variety of ways for you to check it. Now, as you get older, actinic keratosis, or little teeny flaky areas of the skin that happen more and more as you get older. I have never tried this cure that Dr. Wright recommended. I usually have people get retinoic acid cream from their dermatologist and put it on the actinic keratoses, and they tend to go away. But if any of them are red and crusty, if anything is red, in the two big things, red and crusty, then you want to go to the dermatologist and get it burnt off, because then it's on the road to possibly cancerous change. But right before that, if it's just crusty and not red, which happens more and more as you're older, you can use retinoic acid. There is this solasodin glycoside cure that I have no idea, so you might want to look it up and read it yourself. This comes from Dr. Wright's slide, and he really uses this quite a bit, so he put the whole study in here. So you can use topical retinoic acid, and you can give many of the colorful nutraceuticals like lycopene, lutein, beta carotene. I just had Dr. Rani Bannock on my show, and she said for the eyes, pigments protect the eyes. So she likes products that have lutein, xanthion, and mesoxanthion, and even astaxanthin, all the pigments you could possibly get. And on the show, she recommends a product that is possibly Medicare reimbursed. So that'll be in the show notes for the show coming out soon at Dr. Berkson's Best Health Radio. So actinic keratosis can suggest to you that that patient needs more pigments. This is just some way of keeping the skin beautiful, and we're going to go brown spots. This was something I really didn't know about until Dr. Wright gave his talk in Memphis, Tennessee. He says that brown spots are like skin tags, and they suggest insulin resistance. And he said he treats brown spots successfully, but slowly over time, with giving 1,000 milligrams 3 times a day of niacinamide. His favorite supplement of all of his supplements is time-release niacinamide, TID. And there is a company, I think it's called Century Supplements, and they sell a sustained release of 500 milligrams of niacinamide. So you'd have to take 2, and it's $6 or $7 for the bottle. And he feels that it reduces osteoarthritis based on the work of Dr. William Kaufman, and it reduces cognitive decline. It improves insulin resistance, and it helps get rid of brown spots. So this is Dr. Wright's favorite treatment to cover so many aspects of physiology. He feels everybody should be on 1,000 milligrams of niacinamide 3 times a day. It's not like niacin that you have to be careful and titrate up and honor the liver. Most people can handle niacinamide without any problems with the liver at all. Niacin is different. It's a little bit more harsh on the liver, like green tea extracts in concentrated amounts are a little bit harsh on the liver. I had never heard of using niacinamide for brown spots, so I thought this was pretty extraordinary, and he kept imparting to us the importance of getting people on niacinamide throughout the day. So osteoarthritis, niacinamide throughout the day. Cognitive decline, niacinamide throughout the day. Brown spots, and he says it takes about a year of people being compliant with this dosage to get rid of the brown spots. So this is a little bit more about that. Individuals' brown spots on skin pre-type 2 diabetes or type 2 diabetes, they cannot metabolize niacinamide from tryptophan. So part of insulin resistance is, and this was a topic at one of my American Clinical Nutrition conferences, about how important it is to make niacinamide from tryptophan. And you might have a genetic glitch, which means many people in the family get type 2 diabetes. And now Dr. Wright, on his 24-hour hormone tests, has acids at the bottom of the test. And if they're elevated, these specific organic acids, if they're elevated, this gives you an idea that the patient cannot make niacinamide from tryptophan. So he cares so much about this that he has added, that you get just by running your 24-hour hormone study with him, you get a little look-see into whether you're able to make niacinamide from tryptophan. So it could be a genetic glitch, or it can be that there's so much oxidative stress and advanced glycation going on in the body that they cannot metabolize their own niacinamide. So adequate internal niacinamide protects your joints, protects your skin, and protects your brain. So it turned out to be that this was probably the favorite intervention of Dr. Wright's, besides stomach acid and all the other in-depth intricacies, but I thought that was interesting. And here's more citations. The earlobe crease is another thing you can just scan at. Dr. Wright says that the more you have an earlobe crease, and it's right there, the crease would just be in your lower lobe, just your lower lobe. There's like a little crack on your lower lobe. He said the deeper that crack, the more you have. It suggests carotid enamel thickness. He said it has a positive predictive value of 60 to 80%. And of course, you want to go on and measure homocysteine, C-reactive protein, et cetera. Interestingly enough, I was just talking to Davis Lampson yesterday because I order a calcium score or a rapid CT scan on all my patients to look at their coronary artery. He said that's just calcium, though. It's still not telling you whether soft plaque is being laid down. So there's now a growing panel of looking to see if somebody's blood is, if the lining, if the blood vessels are starting to thicken and the blood itself is starting to be hypercoagulable. We talked about this at the live meeting. You should not miss the live meeting that I gave last week. It was really a little bit at the pro level, but I was so excited by what I had learned in Memphis. I didn't want to forget it. I just came back from Memphis, so I did this entire talk. And when I talked to Dr. Holtorf last night on the phone, he has a list of everything that he runs to rule out hypercoagulability. I'm going to get that list from him and share it with you. And it's prothrombin times and fibrinogen. It's a list of components in the blood. He says if any one of them is elevated, he assumes that patients are hypercoagulable, because that's really part of why people are no longer getting well. Is blood is so thick that all the good eating and the nutrients can't get to the red blood cell. And with carotid intimal thickness and then blood thickness, circulation is certainly diminished. And as Dr. Moncrief would always say to me at the dialysis center, circulation is life. Circulation is life. So you have to think of a chronic person who's sitting in front of you, and they've been ill with Lyme diagnosis, Borrelia diagnosis, chronic fatigue for a number of years. They can't get well. You have to think that they have problems in the capillary system. You've got to get their blood able to accept what you do. That's really a paradigm shift. So you got to listen to that talk that I gave yesterday, but that's part of looking at the earlobe crease. Might give you a suggestion of a cardiovascular risk, but that earlobe crease is looking at the endothelial health. So the deeper the crease, possibly the thicker the endothelial level, and the thicker the endothelium, the less functionality in the capillary bed. And then you can look behind the ear at cracks. I couldn't find a picture of just a basic crack behind the ear. This had a rash and a crack. But he was showing us that I downloaded his words from his slides, but I wasn't able to download all of his photos. I put my own in. That a little crack behind the ear is a sign of a zinc insufficiency. And so that was interesting. I didn't know about that. And if there was a rash, add essential fatty acids to it. Earwax, if someone has a lot of earwax, you want to think not enough essential fatty acids. And so that's something to think about. Children's ears are really, children's ears tell you a lot about whether they get allergies. Do they get red right after they eat? Do they have recurrent infections? Used to be that kids were given antibiotic after antibiotic and tubes put in their ears, but if you usually just take them off wheat and dairy, most chronic ear infections just go away. If not, then they have other personal individualized food reactivities, and we know food allergies are on the increase. And you can also do things to improve food allergies like pancreatic enzymes. So after that show that I was on Good Morning San Francisco with Doris Rapp for about 2 years, my waiting room was filled with kids with ADHD, learning disabilities, all kinds of problems. I would say 85% of them were adopted. That's one of the reasons I didn't adopt a child. You know, I always wanted a child, but I couldn't have them because of DES. But after that show with Doris Rapp, I had so many kids come in and they were so difficult to manage. The parents were pulling their hair out, and so many of them were adopted that I got gun shy about adopting a child on my own, not knowing. But usually if you they had to do so many things, identify their food allergies, then limit what they would eat, give them digestive enzymes. It's a lot working with a kid because they're around other kids who don't have those limitations. So you know all that stuff. Hearing loss. Dr. Wright has championed the understanding. His study has been done in men so far, but I have one woman patient who had really severe hearing loss. She had to use an iPhone and read everything that somebody was saying to her. And he's come up with the theory, and he has a slow ongoing non-controlled trial of giving aldosterone 125 micrograms twice a day often partially restores hearing in affected ears. And this is something that Jonathan's come up with, and he is the only test, the Meridian test, that measures the mineral corticoids, so the aldosterone. You get a lot more on the Meridian test than you do on other Dutch tests. I just have such a difficult time working with the Dutch because I don't have all this other information I'm used to taking a look at. So this one patient I had who could hardly hear at all, it was very hard to get her some aldosterone. I mean, it was not easy because it's a compounded hormone. That's the only way you're going to get it. And you have to work with a doctor who's comfortable with it. You can get it from a Walgreens pharmacy. It's not as good, but you can also get a commercialized form. But I haven't found that to work as well as the compounded form. And she went on it for 6 months, and her hearing improved incredibly. She was a dancer with me. And once we were in the dance and the music was on, you could never talk to her because you couldn't hear anything. And after 6 months of being on aldosterone drops, we could sit in the back of the room of the dance hall and talk. So it doesn't work for everyone, but it's something to consider. Tinnitus is really rough to get rid of. Tinnitus is almost impossible to get rid of. There was one study that I found giving niacin, but now I just try niacinamide because it's so much gentler on the body. And one of my members in the group said she successfully treats niacin with essential oils. I've never tried that. A tinnitus with essential oils using tangerine and this other essential oil that I'm not sure I could pronounce, helichrysum. And she would have them rub these oils on the mastoid process twice a day. And this health coach told me that she had gotten rid of several cases. It's very anecdotal, and I haven't tried that yet. So this is just something to think about. Once again, many things that the body shows up can all be a sign of insulin resistance. If your blood sugar isn't working right, many things can go wrong. So sometimes improving insulin resistance improves far off unusual things, for example, like tinnitus. So I had one patient who didn't have any other health problems, but ate a lot of junk food, didn't believe in diet, didn't believe in any of that. And I just had them clean up their diet, and they had a great improvement where the tinnitus wasn't driving them crazy, but it never went away 100%. But I didn't know about these essential oils, and I didn't recommend the niacinamide at the time. We already talked about recurrent ear infections. We're going to take a little look at the eyes. You always want to pull down the lower eyelid if it's very, very pale. And if you look at the gums of the teeth and they're very pale, you can get a sense that and especially if they have cold hands and feet, that they're a little bit anemic. And a lot of women have anemia that doctors don't take seriously. And iron is one of the most important minerals other than zinc. Iron carries oxygen everywhere. Circulation is life, and iron helps you do it. You don't have your iron on board, you are a fatigued camper. And none of your tissues work all that well. You could have all kinds of symptoms because you're not oxygenating your tissues. So if you have iron deficiency, you might have like a kidney glitch that you don't know is coming from the iron because your kidneys aren't just quite getting the right circulation. So iron, I always run an iron panel on everybody. Many of the symptoms of hypothyroidism overlap with iron insufficiency because iron is so critical to get circulation out. So thyroid's a global master hormone. Well, iron mimics many of those symptoms. So just kind of think about that. And you never want to forget, especially in elderly people, hidden gastrointestinal bleeding, especially in people who've been taking aspirin on a daily basis. No matter what They say aspirin causes erosions and bleeding, and it's really harsh on elderly stomach linings. And I have a whole on that textbook that I haven't published yet on my gut textbook. I'm at about 800 pages. I have an entire section on aspirin and how damaging it is to be taking on a regular basis. So that can be one of the causes of hidden anemia, especially in an older person. So here's your signs of allergy. These are allergic shiners. You can be anywhere from a little bit of a mild darkness to looks like someone was hit in the eye. That's a sign of allergies. Pupils dilated in children is another sign of possible allergies. And then if you look, these are Danier's lines right here. So a sign of allergies, looking at this face, this person has very severe allergies that have not been identified. So you got to identify the allergies, clean up the gut, and these body language signs should improve if you're doing things right. Chronic red itchy eyes can be caused by allergies or low-grade infections, prolonged use of eye drops containing steroids. Boy, I've had so many patients put on steroid eye drops that end up getting lots and lots of problems down the road. So Dr. Wright talked about exploring working with compounding pharmacies with eye drops of vitamin A and vitamin C, which strengthen the surface of the tissues of the eyes to resist allergy or chronic infection. I have never done this myself. I just give people more internally. So I think you can work internally, but often people don't take enough of these, like vitamin A. Now you've heard of giving it in higher dosages than as you probably felt comfortable with prior to this talk, although you don't keep them on sustained high dosages. So if someone came in with chronic red itching eyes, and they didn't have any liver failure, they didn't have any liver disease, they were basically healthy, I might start out at 75,000 units of vitamin A for a few weeks and then go down to 50 and then go down to 25. If you have too much vitamin A, you always should tell someone the symptoms of excessive vitamin A so they would know they should back off. And that's usually a headache. The first thing is the headache, and the skin on your fingers tends to start to flake. Those are the two biggest signs of too much vitamin A. And I have never seen that in a patient ever. And I have been working with high dose vitamin A for short periods of time because Dr. Wright encouraged me to do so many decades ago, as we see on his slides here. And I've never seen those signs, but you always have to say it just to cover your lower derriere. Dry eyes, I thought this was really interesting. He said testosterone insufficiency can cause dry eyes. And apparently testosterone helps the meibomian gland in the eyes make moisture. So, you give fish oil, hydrate, none of that helps dry eyes. Dry eyes are very irritating, and you can get strained eye syndrome from sitting in front of the computer that promotes dry eyes. So I thought it was so interesting that testosterone has something to do with keeping your eyes lubricated. And we're seeing more and more people have, not only are there estrogen disrupting compounds, there are many androgenic disrupting compounds. In fact, there's so many compounds that work like estrogen and tamp testosterone down that the net effect is people are being more feminized. The human race is being a little bit more feminized, that because the balance of E to T is off, and who knew that it had something to do with dry eyes? So I thought this slide was pretty, do you think this slide is interesting? Is this interesting information? What do you guys think? I want head nodding. No head nodding. Yes, good, head nodding. This is how he treats conjunctivitis. So I thought that was very helpful. So remember, you're going to have this as a PDF. So when a patient comes in, all you have to do is when we get out of this, I'll show you, you have a bar at the top, and whatever the condition is, you can write it in the bar and it'll bring up the slides so you don't have to go through the whole slide. So just make sure that you know how to do that. Here's some of the ways he treats viral conjunctivitis. I have never seen anything work for cataract. I think the cataract surgeries they have today are so phenomenal that I don't see any reason why you should try not to treat a cataract, but cataracts are a sign of insulin resistance. Or they're also a sign of oxidative damage. So for example, I was so ill so often when I was younger. I had so many CAT scans and so much imaging done that I had large cataracts when I was fairly young because my illness from being a DES daughter exposed me to so much radiation. And I also lived in Australia for 6 months and was a rogue and didn't believe in sunscreen and was out where there's no ozone layer. And I've been outside playing tennis the whole first 30 years of my life. I was outside without a lot of protection because nothing's going to harm me. So I got cataract formation and I got rid of my cataracts, and it was really an easy surgery and it made a big difference for me. But you also want to remember the cataracts can mean oxidative stress, and cataracts can also mean insulin resistance. I have to say that being in the pandemic for the first 6 months and buying everything at the farmer's market and eating so many colorful vegetables and not eating out, little teeny things that have bothered me for years have almost all gone away. It was like going away to a health spa. So there's so much to be said for getting down to eating well, but consistently, and many colorful vegetables consistently, to reverse many of the oxidative stress and things that we deal with. But what was interesting is he said that cataracts are also formed by high elevated aldose reductase, which his Meridian 24-hour hormone ultimate test does measure, and the way to deal with that is quercetin. Here's a whole herbal complex for reversing cataract formation that I have never used, but if you want to try it, this is from Jonathan, and here's more. He's got quite a bit on cataracts. So floaters, he said it came from the physician's desk reference that a combination of choline, inositol, and methionine could reduce floaters. I have never worked with that, but that's pretty interesting. There is a product in Italy, an eye drop for glaucoma made out of citicoline. So when I was first diagnosed with glaucoma, and if anyone comes in and they're even a glaucoma suspect, you should be treating them for glaucoma. There's so many things to do, but they have been slowly reversing glaucoma with citicoline eye drops, and I couldn't get anyone to make me those in the United States. I called up all the compounding pharmacies that specialize in ophthalmic drops, and it's only in Italy, but it's very similar to this combination of choline, inositol, and methionine. Citicoline. So the cholines and the methionines, these all are very powerful for the eyes. If someone has eye disease, I would look at citicoline, choline, inositol. These are all things that are very helpful for the eyes, not just for floaters. The biggest thing with his slides with glaucoma is the work of Emmanuel Josephson, who said that glaucoma was really a flashing red light of adrenal weakness. And he documents normalizing intraocular pressures in half of people using IV ACE injections, adrenal cortical extract, which we used a lot at the Center for Orthomolecular Medicine when I first worked, where Christine worked, in Palo Alto, until they made it illegal. So what's interesting is Jonathan said there are drops online. You just put in ACE sublingual drops, and he said he's found them to be 85 to 90% as effective as the ACE injections. Not totally, but there's 500 genes for glaucoma, and everyone in my family has glaucoma. So I have a genetic tendency, but I didn't start being a glaucoma suspect till my adrenal gland was removed. So I only have one adrenal gland, and then my glaucoma genes kicked in, and part of treating a person with glaucoma is looking and evaluating their adrenal health, seeing what they need for all the things you need to do. So just keep that in your consciousness. And it's very interesting. There's different types of glaucoma. We're not going to go into the whole thing, but I have a podcast by Richie Rich. He created the trabeculectomy surgery. He is Dr. Glaucoma, other than Alan Crandall, who just died at the Moran Institute. He's the deal. Richie Rich is Dr. Glaucoma. He's been in practice, I think, almost 60 years. He's almost older than God. He was the funniest person to interview. He would chat about something and go, nope, cut that out. I don't like that. He would dictate the whole talk. But he said that one of the things you can do to preserve your optic nerve is to have salt before you go to bed. So he recommended everybody have a little glass of salted tomato juice, because that helps keep up your blood pressure at night. That your blood pressure is supposed to dip at night and do all these different things that nature set up in a circadian rhythm to keep you healthy while you sleep. And people with glaucoma tend to have problems with that blood pressure normalization at night. So Dr. Richie Rich said, consider tomato juice before you go to bed, a little sip of it, a few ounces. And Dr. Wright says, take the ACE sublingual drops. And you know, of course, other things to do for adrenal glands. The one other thing with glaucoma is you want them all to avoid glucosamine. Glucosamine is a wonderful supplement, but it elevates intraocular pressure. Here is a protocol for retinitis pigmentosa, and I'm going to let you read that on your own. Here's when your cornea thins and gradually bulges. So I'm going to let you go through these eye. If you have anyone with eye problems, just go to this section and I'll show you how you type it in, and you can bring this up when you have someone with eye problems. There's no reason to go through all these different eye things, but let's go into the tongue. I thought he had a cute little tongue. So Dr. Wright says if you have a really thick crack or crevice down the middle of your tongue, it's a sign of methylation issues. And often you need methylfolate or B12, and he likes giving 1,000 micrograms at least a day of each. The fissures improve a little bit, not a lot. I've not seen people with huge tongue fissures totally go away, but I have seen that huge tongue fissure down the center of the line does often correlate to the genetic glitch of methylation, MTHFR glitches. You know, if you have a white-coated tongue, this could mean that you have candida, so certainly that's a candida infection. A scalloped tongue we've already gone through is a sign of suggestion of hypothyroidism and or food allergies. A pale tongue tells you that there's not enough iron. Always, tongue tells you a lot of information. A red tongue screams that you have B vitamin insufficiencies. A loss of taste sensation is a sign of zinc. So one of the reasons COVID makes you lose your taste and smell is your body uses up its zinc reserves to try and stop the virus from replicating. That's why I took massive amounts of zinc and I didn't really lose my taste or smell. So people that come in and start saying they're losing their sense of taste and smell, you want to take a look at giving them enough zinc. Picolinic acid is internally synthesized from tryptophan, which is made by the pancreas and is the zinc binding ligand for intestinal absorption. And so sometimes people really aren't utilizing their zinc because they need more pancreatic support. Alex Schaus, I stayed at his house once when I was working with Dr. Wright. Alex Schaus is a specialist in eating disorders, and he would say that a big part of anorexia nervosa and eating disorders is due to zinc insufficiency, because zinc has so much to do with taste, with satiety, with our relationship with food, and our relationship with hormones. You can see how iron and zinc are they're just incredibly important to assess in a patient. Tongue diagnosis is something that a lot of Chinese docs do. It's very important to really know that the patient has excellent mouth health, because 50% of colorectal cancers, as I said earlier, contain pathogenic oral bacteria like fusiform bacteria. So if somebody has bad breath, if they had coated tongue, if they have spongy, thickened gums, you really want them to clean up their act, because it's going to be hard to get them well if their mouth isn't attended to. A lot of people say, well, I'm a bleeder, I just bleed. People bleed only because they haven't flossed a lot or used a water pick a lot. Once people start flossing correctly and using a water pick and taking probiotics and eating a more diverse, pigment, colorful diet, gum problems clear up. We will talk about some of the ways to clear them up here too. Interestingly enough, we know strontium is important for bones. Who knew strontium was also important for tooth decay? So if somebody has a lot of history of cavities, you might want to give them some strontium for a little bit. Gingival inflammation, CoQ10 has something to do with it, and folate. They used to make, when I first learned about this 30 years ago, there used to be a liquid folate mouthwash, and I don't think it's available anymore, but if you flossed your teeth and then used the folate mouthwash several times a day, it got rid of a lot of the gingival inflammation. And sometimes women during pregnancy get gingival inflammation because they have so many hormones that the body is filled with during pregnancy. They use up all their cofactors and nutrients to process those hormones. So they end up getting these little different symptoms because they're using up so many things so rapidly. So folate is very important to give during pregnancy, and it can help gingival inflammation during pregnancy. And I didn't know that D-mannose powder stimulates gingival stem cells. So if someone comes into me and they're having problems with receding gums, I'm going to have them do mouth rinses with D-mannose, because that's what this says, is that D-mannose boosts gingival stem cells. Well, that's really incredible to know, but that would mean someone would need to do this on an ongoing basis. So that's really a great thing to learn and to recommend. Gingival that's spongy. So this tongue looks kind of spongy, and that means either a lack of iron or vitamin C. And you see a lot of, this is a geographic tongue. Besides a red tongue, a geographic tongue suggests insufficient B vitamins. Sometimes if a person is eating a high sugar diet, it rinses lots of B vitamins out. If they're estrogen alpha dominant, and progesterone insufficient, that rinses a lot of B vitamins out. If they consume a diet high in high fructose corn syrup, that rinses a lot of B vitamins out. I'm just looking at our time frame here. Canker sores, the biggest thing with canker sores is to eliminate food allergies. Gluten is the #1 sign, because gluten, celiac disease in particular, so gluten sensitivity and or celiac, which is an autoimmune response to gluten, it can create canker sores within 24 hours of a gluten exposure. So recurrent canker sores are a flashing red light to suspicion celiac disease. All of the lauryl sulfates in toothpaste can cause canker sores. So if someone has recurrent canker sores, you want to, and I like the Himalaya Indian toothpaste because it doesn't have any of that in it. So these are about the canker sores, and this is the lips. Wherever there's a lot of things around, the cracks around the lips keep having little spots on them, sores on them, you want to think of B vitamins. Always think of B vitamins. Here's some things on herpes, and now we're going to the hair. So we have a whole section on hair loss in women. Hair loss in women is devastating. Women come in with a plastic bag with hair in it, and they sob and they cry because hair is a crowning glory for a woman. So you always want to take hair loss seriously. Top of the list, B vitamins, and then we're going to go through iron and thyroid. Iron brings circulation everywhere, which helps hair follicles grow. You have so many active hair phases going on. You need lots and lots of circulation to the scalp. That's why when you get older, your circulation gets worse, and most people start losing a bit of hair as they get older because the circulation is worse. Birth control pills rinse so many nutrients out of the body that some women can get hair loss that's secondary to birth control pills because they weren't taking a multi or something to replete those nutrients. And pregnancy, you have so many hormones and so much going on, it has a higher demand again for the cofactors to process those hormones. So a lot of women can lose hair during their pregnancy, but if you get them on a good program afterwards, it should come back. You want to think of not enough stomach acid. You want to think of low iron. If their protein in the blood is in the 6s, you want to give them some amino acids. They just start getting the amino acids without even needing their own body to absorb it. When you give them, you give an amino acid full spectrum on an empty stomach. And sometimes low DHEA will be linked with hair loss. So you always want to look at DHEA levels, and you want to measure DHEA, the active form of DHEA. There's two ways of measuring it in the blood: DHEA sulfate, so it's DHEAS, and then DHEA. DHEA is the more active form. The sulfate form is the reserve form. So when you're ordering it in the blood, you want to look at just plain DHEA. DHEA is a sign of adrenal health, and it's an androgen, and it tends to be insufficient in postmenopausal hair loss. This is one regrowing hair in women that are losing hair is tough. It's very tough. And sometimes you don't succeed. It's not that easy. Some women, you just improve their thyroid, you improve their digestion, you give them a multi, you give them some amino acids, you get them a little bit on iron, their hair starts growing back, but it takes 6 months to a year and a half. You have to really be patient with improvement. And some women just don't improve, especially if they're getting older. And they're devastated. So some of my patients have said that this one serum, it's about $80 for this one serum. They have a whole line of things, but in particular, it's called harlequinone serum, has been very helpful. They mix it with 5,000 micrograms of biotin once a day, amino acids, digestive enzymes, rule out a fatty liver that blocks absorption of everything, rule out hypercoagulative blood, which we'll go more into in another talk, exactly how to do that. But fatty liver is suggested if in a woman the HDLs are below 50 and her liver enzymes are starting to creep up in the 20s or are elevated, because fatty liver means you're just not absorbing much food anymore. And fatty liver is on the increase even in children. Person has fatty liver, they're having a terrible time absorbing nutrients and processing their hormones and processing pollutants. They're just, once your liver, which is a very demanding, busy organ, is shut down for business because its hepatocytes are filled with fat, it's very hard to have a healthy person. So if I look at a blood test on a woman, she should have HDLs in the 50s. If it's in the 40s, that says to me she might have fatty liver. If her liver enzymes, in a teenage person, liver enzymes are in the teens. As we start getting a little older, they get in the 20s. I like to see them in the low 20s. The minute they start getting in the higher 20s, the liver's getting tired. And when they get in the 30s or elevated, that means that your liver can't do the function that it means. And you can order a hepatic ultrasound. And at the clinic where I worked at in Tulsa, she would tell us the degree of fat that this liver had. She would literally write on there, this person has 15% fatty liver, 50% fatty liver, full fatty liver, cirrhosis of the liver, scarring of the liver. You can't get that anymore from any of the sonographers. I don't know why, but I rule out fatty liver in so many patients, and I have found it in about 25, 30 patients in the last year and a half. And I look, are those HDLs low? In a man, usually with fatty liver, their HDLs will be below normal, and their liver enzymes will be high normal. And they usually have a few extra pounds and they're really tired. And you've got to clear up fatty liver or you can't really do anything. So any chronic problem, and hair is a chronic problem, it's really rough to grow hair back. You want to make sure that the liver is functioning really, really well. So this is a summary of hair loss in women and hair loss in men and dull hair. So you can kind of go through all this on your own. And just take a little look. Recurrent sore throats are food allergies, and clean up the diet. But remember that reflux, one of the symptoms of reflux is waking up in the middle of the night or the morning with coughing and a sore throat. So you can have aerosolized gastric juices that show up as recurrent sore throats. So reflux can cause a recurrent sore throat. Recurrent strep throat, you want to get all the allergy foods off. And so here's some things for that. If you palpate the neck, and most often if there's no set infection or there's no flu, if you have chronic lymph swelling, most often it's due to allergies that no one has identified. And don't forget, allergies could be to spinach, could be to celery. We say the most common food allergies are milk and wheat and corn, but it could be to a food that you haven't figured out. I had one patient that just couldn't get rid of these rashes all over her body. And we did a full allergy screen. I use Food Safe by Meridian, and she was allergic to pepper, ground black pepper. And we took black pepper out of her diet and her food allergy went away. Now you wouldn't think of that. So food allergies can be anything. Upper arms and the shoulders. So if they're really tight shoulders, you want to think of ergonomics because everyone's looking down at their phone and the computer. And you want to think of magnesium because magnesium is nature's muscular Valium. You also want to think of jaw issues because that relates to the neck. And people are always down here and they need to do enough exercises to offset that, and they don't. So that's something that you can talk to them about. He had something here called supraclavicular convexity, which again is based on William Kaufman, who's the medical doctor that was so into osteoarthritis and reversing it with niacinamide 1,000 milligrams 3 times a day. I never tried it for subclavicular, but this was interesting. He said bursitis you can definitely treat with injections of B12 and giving stomach acid. He's got a case of frozen shoulder, giving galenium. Here's the bumpy skin on arms that we've already talked about. He said hives, and he has this one treatment that's based on one of Dr. Wright's heroes, Henry Hauer, and he has eliminated Tahoma Clinic physicians, based on Jonathan training them about Dr. Hauer's work, have eliminated chronic hives in 100% of cases with 6 injections each of spleen and thymus. And he does cell therapy. Cell therapy has saved my life. I've done cell therapy on my eyes, my adrenal glands with Dr. Wright, but when I've tried to get a hold of the same cell therapy from the company he gets them, he won't share that. But I have used it on a number. I had one woman that had chronic adrenal insufficiency for like 15 years, did everything. And Jonathan kindly let my patient order cell therapy and get it shipped here to Texas and had her local nurse inject her because it's IM injection in the buttocks with the cell therapy he has. So she did a series of these cell therapy shots, and that was it. She had no more adrenal insufficiency. So there's something for you to just be aware of, that there's a whole nother world. It's not stem cell, but it's cells that are already differentiated. So it's not near as expensive, but it's not cheap. And it was one of the ways that was part of my eye program when I reversed my diagnosis of irreversible blindness. So there's some more skin things. You can read this on your own, but look at this. Here's psoriasis, rule out Helicobacter pylori. So any skin thing, is the person able to make stomach acid? Do they have a bacterial infection that's part of their stomach acid issue? So here's a whole bunch on psoriasis and other. It was interesting, he said that if women have decreased hair on the forearms, that tells you how much DHEA you make. When I tested my DHEA a number of years ago, I have no hair on my forearm and I had no DHEA. My DHEA was undetectable by the lab after I'd had so many organs removed. And every time I tried to take DHEA, I'd get cystic acne. So I went on 7 keto DHEA, and slowly but surely my DHEA has been creeping up, and took pregnenolone, which helps elevate DHEA. So slowly but surely my DHEA has been slowly rising, and I'm slowly developing some hair on my arm. So that's another interesting body language sign. Carpal tunnel, there's 2 types of carpal tunnel: nutritional deficiencies or biomechanical. So you always want to rule out if it's really just a B6, a pyridoxal 5-phosphate. So pyridoxine hydrochloride is the major form of B6 that not everybody can use. And then the body phosphorylates it to its active form that everybody can use. That's pyridoxal 5-phosphate. So pyridoxine hydrochloride is phosphorylated into pyridoxal 5-phosphate. That is the most bioavailable form of B6. You have to be careful. There's a few articles in the literature where giving 100 milligrams a day caused reversible neuropathy only after taking it for a few months. But the protocol, if it is by Dr. Ellis, is a high dose pyridoxal 5-phosphate. So it's only given for about a month and a half, and then you start to taper down. Interestingly enough, if that didn't work, they also tried mixing B12 with DMSO, which I thought was pretty interesting. And I never heard of transdermal progesterone injections for carpal tunnel, but this is what Dr. Wright recommended. So I thought, well, isn't that interesting to talk about? So I'm going to let you go through most of the rest on your own. Just also remember that anytime fingernails are chipped or cracked or don't grow well, flashing red light of not enough stomach acid. That is a classic sign of not enough stomach acid. Joint pain, not enough stomach acid. Estrogen also dictates chondrocyte integrity. So at the conference I was just at, there was a naturopath who gave a really elegant talk on the role of estrogen and cartilage and joint integrity. And she showed rodent studies and rhesus monkey studies where they removed the ovaries so they became estrogen insufficient, and they tracked all the joints in the spine, and slowly but surely these animals, they even had one study on rabbits, would develop everything that the aging spine develops. They start developing retrolesthesis. They start developing facet asymmetries. They start getting cysts, disc degeneration, osteophytic activity. You go crazy when you look at an MRI like that. But if someone's muscles and ligaments are healthy, you can have a terrible looking MRI and still be asymptomatic. But they could create the typical aging of the spine by removing estrogen. And then if they gave estrogen shots back to these animals, they slowly reversed all of what had happened to the joint damage. So stomach acid and hormones, these are essential to slow down many of the things of aging. And for some reason, this isn't in the medical school curriculum. It's not taught that way for doctors to honor the role of hormones. Here's a little bit more about the fingernails. So interestingly enough, there was a big television show that my friends in Florida are really into with this husband and wife called Chopsticks. They go everywhere in the world and eat street food. And we noticed that his fingernails were completely white. And I said, that means he either has liver disease or he's got a problem with anemia. And we looked it up, and sure enough, that was the deal. So it's good to know all of these things. And you've got a whole list in this talk. Interestingly enough, we're going to be going more and more into peptides, but there is a umbilical cord stem cream with peptides added to it that helps some severe osteoarthritic joints. And this is available now by Dr. Holtorf. So in another of our talks, we'll talk about this. And I was talking to him last night on the phone. He's going to give another training on peptides, and he's gotten his peptides patented, so they're now supplements. They're not prescription. So I'm going to try to arrange with him that we could all have access to purchase his peptides in some way via a line that we're going to make so that you can use them on your patients, because right now it's very hard to get peptides for a prescription. The compoundability was removed, the legality of it a few months ago, but his peptides, he spent multiple thousands of dollars making them supplements. And so I'm going to, as I learn more from him, train you on the use of these peptides that you could have access to. So I just want you to go through all of these. I think we're going to call it a day on this. Let me see if there's anything else that's just a must here. So of course, if you have bloating higher up, it suggests a SIBO infection and not enough stomach acid. If you have bloating lower down or several hours later after a meal, it suggests pancreatic enzymes. Take a look at the fat in the stool, and it suggests possible dysbiosis in the large intestine. And it takes you all the way down to the end of the body. I'm just going to take you through these. I give plantar fasciitis. I went through this early on in the pandemic, so I kind of go into that. And he gives a little bit about spinal analysis. Dr. Wright really respects chiropractors, so he always tries in every exam that he does to take a look and see if the spine is moving really well, to see if there's any spinal subluxation that has anything to do with presenting itself with the patient. So he's very honoring of that, and he knows that sometimes the patient really needs to get an adjustment. So here's some of the references that's all here, and it's quite a bit of, as you can see, and I'm going to end sharing here. Let me take us out of sharing. Stop share. So it's 150 slides. And when you get to the top of this slideshow, what I want you to know is you can go to this. Oh, I think you still need to see this. I'm going to screen share one more time. Sorry. Screen share, share screen here, share. So when you when you have your PDF, you can go up here and write in the condition. Let's say you remember you have a patient who comes in with hearing loss, and you remembered it was something to do with aldosterone, and then you just search it, and it's going to take you to the slide with that. So you'll keep this as a PDF on your computer for yourself or for your patients or your family. Don't forget to use this search bar. So if you were to go in here and you would say, I want to look at rheumatoid arthritis, and if you do that, it's just going to bring up all the rheumatoids. So you can easily search through this PDF. This is gold. Total gold, because it gives you so much. You can see how much you can learn by looking at a patient for a few minutes, and then also how you can get into the details of someone. Let's see it. I have a consult at noon, so we've got a few more minutes here. So I am going to, did I end my screen share? Where am I at? I have ended it. So now let's have a few questions. And we only have so much time.
I don't think there's any questions in the chat right now. You guys should be able to unmute yourselves. If not, message me in the chat and I will ask you to unmute, and that should work. But if anybody has any questions, just go ahead. Or if you don't want to be on camera or audio, you can drop the questions in the chat.
So one of the benefits of being in the membership is that every time I lecture, I listen to everybody else's talks, and I go around learning more and more things, and then I'm just sharing these immediately with you. And I'm having to fly, I'm having to be in a hotel, having, the cost of some of these things, the cost of that total seminar, 5 days, ICIM, if you did the ozone, which I did in the morning, and you did Dr. Holtorf in the afternoon, and you did the conference, it was about $3,000, not including the hotel and the flight. So I'm trying to take all this information. That's why I was so excited last week to talk about hypercoagulation. I didn't want to lose it because it was such a new concept. So you're getting funneled in a lot of this information, and this one PDF is brilliant. I did mention, because some people came on later, that a lot of this is based on Dr. Wright's body language presentation that he gave at ICIM, and I've added a lot of different things to the slides, but these slides come from Dr. Jonathan Wright, so you have to promise, I'm giving you a PDF of these slides for your own use, but you can't share them with anyone else. This is really something that's gifted to you and that you would have only gotten if you went to that conference. So if you can just honor that, not sell them, or you can certainly share one or two here and there, but you wouldn't want to use this for a lecture or to give away to other people, because it's proprietarily owned by Dr. Jonathan Wright, just to keep that in mind.
And we will put those up on the archive pages once we get those transferred over to PDF form. Christine asked, what brands of methylfolate do you recommend? And go ahead.
I use metabolic maintenance. I find that people are reactive to a lot of different forms of methylfolate, and I found that to be one of the least reactive brands. And they also I start with very small amount. So they come in it's 2 or 2.5 milligrams. I think that's what it is. And then they come in 1,000, I think they come in 1,000 micrograms, 2.5 milligrams, 5 milligrams, 10 milligrams, and up to 20 milligrams. So you have this dose range, and you have to start very low, and usually once a day, then go to twice a day, then double that. If you give somebody who has methylation genetic issues too much methylfolate right at the start, it makes them feel worse. So you taper up. So I like the brands that have these little doses and then they build to other doses. I find that most people do really well with around 2 milligrams of methylfolate twice a day. I'm not into the 10 and the 15, but once in a while you get somebody who doesn't function well unless you give them a big wallop. But I use metabolic maintenance.
And also, can a client work with Dr. Wright or only staff at the Tahoma Clinic?
Dr. Wright is still seeing patients. So he is still actively seeing patients. But he didn't come to the conference, and he did sound like he wasn't quite feeling 100%. So we're all hoping that he can kick back in. So Dr. Wright's pretty amazing. I think to see him is about per hour. I think it's about $750 per hour, and then if you're there longer, they charge according to the hour. And then he has all that testing. I send some of my patients from Washington to him, and we co-team on these patients, and he's wonderful to work with. What I use a lot at his clinic is their desensitization program. I don't know if they make that available for other docs, but I don't see any reason why. It's very inexpensive, and they can test a patient on any hormone except growth hormone, and they can test them and then desensitize them. And I just had a patient who has never been able to take progesterone. Every single time she tries to take progesterone, she gets seriously ill with terrible diarrhea. She has a history of severe endometriosis much of her life, and we desensitized her through Tahoma Clinic with progesterone, and we also gave her human chorionic gonadotrophin treatment for 3 months. I just talked to her yesterday. She has no problem with progesterone anymore. That's all gone, and she's so elated that she wanted now to get tested on all her other hormones. And the HCG treatment, which is just an extraordinary treatment for endometriosis. I discussed this treatment at the beginning. It was one of our very first meetings. So if you just joined, you want to look in the archive section for endometriosis treatments. So she took HCG for 3 months, desensitized to progesterone, got her on digestive enzymes. She feels better than she's felt in decades. She just she feels like she's a different person. So there's so many things that we can do, but they're very much out of the box, and that's why we have these sessions. But don't forget, there's so many goodies in some of the past sections, and don't forget to watch last week's live on the new role and appreciation of the capillaries as part of the immune system, and capillary dysfunction and hypercoagulability as part of getting really chronically ill people well.
All right. And one last question that's here. Was there a photo of an image of the ear crease, the earlobe crease?
I couldn't find an image of the earlobe crease. So I'm going to have to take a picture next time a patient comes in with it. It's very common, but I couldn't find a picture of it. I downloaded the words from Jonathan's slide, and I put in a lot of my own, but I couldn't download any of his images, and he had a picture of that. But let me see if I can bring up his, see, maybe I can screen share.
Well, and while you're doing that, what are good brands of bioavailable vitamin A?
Okay, I don't think I'm going to be able to do this while I'm on Zoom. You know how slow Zoom is. Yeah, it's going to, well, here it is, just a second. And let me see if I can put this in ear crease. CREASE. See. CREA. See if that does it. Here it is. Here's the earlobe crease. And let me share my screen. This is his slide. So if I go back in here and share screen, and where is that? Here it is. Now I can show it. So do you see the earlobe crease? Right there. I guess what I'll do before I send this in is I'll make a little, let me just do this now. I'll do a screenshot of this and I'll put it in that slide. And I'll put it in there. So now I'll do that. Okay, I'm going to end stop share. So everybody saw that there? This is a severe one because it goes all the way from the inner hole all the way to the end. Sometimes the creases will just be partial, but Okay, so there we go. We brought up an earlobe crease.
There
I'm
you
pretty
go.
pleased
And so
with
the good
myself.
brands for bioavailable vitamin A.
I love Biotics AE emulsion, but it's funny. I guess it's gotten more expensive in the pandemic. So somebody asked me for an inexpensive form of vitamin A a few months ago, and just told you I took a real high dose of vitamin A, and there was no by Biotics AE emulsion left where I buy a lot of my supplements and I get my doctor's discount at a compounding pharmacy near here. So I went over to CVS and just got their vitamin A from CVS and took that large dose I told you and was waiting to see these heel cracks go away, and that one worked fantastic. So I was shocked. So when my patient said, God, I just can't get a hold of Biotics and it's kind of expensive, I recommended they get the CVS. So sometimes some of the drugstore supplements are okay. Most of them aren't, but I found that their vitamin A was pretty efficacious. So there you go.
And you do have the full script link for the discounts through your full script dispensary that's on the website and the
Right.
products.
And as a practitioner, you should all get your own full script account. If you get your own full script account, you can give discounts away and all your patients can get whatever they want in there. It's something that all practitioners should really sign up for. And then that way, let's say you want to give your patients a 5% or a 10% discount. They have a link with your name on it. And every time they purchase it under you, you get a little bit of money. So it's kind of like having an inventory. So that's something all of you should do on your own. So I have my own script, full script link. You can go in and use mine. And I think it's set up right now to give a 5% discount and any purchase over $50 to have free shipping. And you can do that through mine. And then when you purchase it, I get a little bit of money from you purchasing it. Or you can set up your own account and then create that slight bit of income, but it's convenient for your patients. Full script has 11,000 different products. They've got Berkey water filters. They've got pet products. They've got all doctors' lines. Full script is merged with Natural Partners. It started from Natural Partners. And Al Zapp, that founded Thorne Research, boy, somebody's walking and I can't watch because I can see the ceiling. It's making me dizzy. He started a brand new company called Tesseract, which has some of the best products available on the market. The most bioavailable, he has the most bioavailable glutathione that exists on the planet. He only has a concierge set of about 7 or 8 products. That's it in Tesseract. That's Al Zapp's next thing after Thorne. He created Thorne. He was a genius in our industry. He had a non-compete clause. So while he sold Thorne and was waiting for the non-compete clause to expire, he came up with this new matrix delivery system of supplements, and he created this little concierge line, Tesseract, and it's only available through FullScript. So if you want to have your patient be on anything from Tesseract, they're all brilliant. We could give a talk if you want some time on those Tesseract products, like their glutathione product. It's available through FullScript. They can't really get it. I think Mark Hyman is so excited about the products. He's selling a few, but charging amazing amounts of money for them. But I think it's mostly available through FullScript. So FullScript gives you access to doctors' lines and many, many things at a discount, mostly free shipping. And if you want, you can make this a little bit of an income revenue for yourself, or you can hop on mine and just be convenient, send your patients to mine, and I get a little bit of it. The patients get convenient and I get a few bucks along the way. So it's whatever way you want to do it. But it's so great to have access to doctors' lines and have people be able to go to one spot and get one-stop shopping as much as they can get, because otherwise they're getting things all over the internet. And the problem with buying doctor's lines and nutrients from Amazon is Amazon has huge warehouses. They're not all air conditioned. And there's a lot of discussion in the nutraceutical industry that the products sold from Amazon have really gone through a lot of heat damage and they don't know how long things are in there and so forth. I'm going to have to go because I have a conference call in 2 minutes. So it's time for me to go. So I hope that you have loved this. I'm going to add that earlobe picture onto the earlobe slide. And
JD said thank you for that and for adding that.
Okay, wasn't this interesting?
Yeah. It was.
Okay, everybody, I'm sorry I got to run. Blessings. Take care. See you soon.